My name is Lilian Nabasire. I work with SNV in the West Nile region, where Rhino Camp is one of the sub-counties where we are intervening with a sanitation and hygiene improvement program. Rhino Camp is a fisher community lying along the Nile belt. And in a fisher community, generally they have clustered settlements that are sparsely distributed on the horizon. So you find one community living a good distance away from another community, but in the concentrated community they have a dense population living in one particular location. That means they are generating quite a lot of fecal matter that is left uncontained, and that will come back into the food chain, it will come back into the water streams. So access to safe water in such a community is equally important, and modalities to do it at household level then makes it easier and safer, especially for the young children and the elderly people who tend to live within the same communities. Need not say about the disabled communities and the women who walk long distances to fetch water for home consumption and other uses within the household.
Bernard Eyadu is my name. I work as an advisor in water sanitation and hygiene. And safe water chain has always been a problem in the sector, be it at household level, institutions such as offices, schools, and hospitals. Now, with the introduction of TivaWater, we are now having a one-point center, because traditionally you have to transport the water, you have to store it and consume it, and the risks are very many, from the transportation, from the storage, and at the point of consumption. We will try to use two-cup system. We will try to use water filtration, but water filtration cannot be done in the schools. A two-cup system cannot work in the schools where there are very many children. So, with these filters, even if the transportation, there's a problem with the transportation of the water, that is from the water source, from the borehole, you have a dirty jerrycan, and you bring it and pour it onto the filter, you are sure that the process it goes there, at the end of it, it will be clean. This technology is very good for both households and institutions such as schools. I really promote it and encourage it. Thank you.
My name is Chemisto Satia Ali. I work as an advisor for water sanitation and hygiene based in Kampala. SNV Netherlands Development Organization has had over 3 years partnership with TivaWater, and one of the things that we envisaged in this partnership is to extend and expand access to safe water amongst our population in Uganda, and especially in the rural communities. This partnership, we've seen, has yielded a lot of fruits, in the sense that in the districts where SNV has worked, many communities and households have had access to TivaWater filters, which has helped to improve significantly the rates of the health problems related to waterborne diseases. We also feel that as a result of this partnership, it has encouraged other institutions like the Uganda Water and Sanitation NGO Network to emphasize the use of methods that are very simple but effective and efficient in promoting safe water in Uganda. SNV is the current chair of the Uganda Water and Sanitation NGO Network, and our partnership has facilitated the process of promoting improved access to safe water in this country. So the relationship that we have with TivaWater is going to continue to strengthen and ensure that more and more of Ugandans have access to safe water as a result of using the filter. Thank you.